Hi, and welcome back to Act on Mental Health. My name is Sean Hardy, and I'm a licensed mental health counselor based here in Fort Wayne, Indiana. This is the fifth video in our series, walking through acceptance and commitment therapy, 100 key points and techniques. If you've been watching from the beginning, we've explored the behavioral foundations of ACT, relational frame theory, or RFT, the 6 core processes, and how to assess and formulate client concerns through a functional contextual lens. In today's video, we're diving into keys 45 through 64, which highlight practical techniques that move the core ACT processes forward. These exercises, from present moment awareness to defusion, values, and committed action, are how we help clients build psychological flexibility and live richer and more meaningful lives. So let's get started. In ACT, contact with the present moment is more than a mindful buzzword. It's a gateway to awareness and choice. Many clients spend large amount of time caught either in the past through rumination or future with worry, often driven by unhelpful thought loops. Helping clients return to the present anchors in the only moment where meaningful action can occur, which is now. Present moment techniques typically involve grounding and orienting strategies. You might invite clients to focus on the rhythm of their breath, the sensations in their feet, or the sounds in the room. These aren't distractions, but deliberate contact, a practice of shifting attention gently and curiously back to the immediate experience. These exercises work best when they're relevant and brief. For example, instead of launching into a full body scan, a simple notice 5 things that you can see right now might be more accessible. We want the client to practice awareness without judgment, especially in emotionally charged situations. The aim isn't to feel calm necessarily, it's to become more present with whatever is happening, even discomfort. When clients learn to observe their experience rather than being consumed by it, they gain a new kind of freedom, the power to choose how they respond right here, right now. ACT practitioners often talk about mindfulness with a small m. This refers to informal, moment-to-moment awareness, not formal meditation practices, but the kind of mindful noticing that can happen during everyday activities like walking, washing dishes, or brushing their teeth. This form of mindfulness is integrated into life, not something that requires a cushion or a quiet room. The therapist might ask, "When do you notice you're most checked out?" and then introduce a practice to check back in. It could be a mindful cup of coffee where the client brings full attention to the smell, temperature, texture, and taste, or a brief pause before opening a difficult email. The benefit of mindfulness with a small m is that it supports flexibility and context. Clients don't need to escape their lives to practice presence. They build it into real-time challenges and routines. In fact, helping clients notice their inner experience during uncomfortable moments like work stress or family conflict is often more powerful than any formal practice. These micro moments of awareness create space. They interrupt autopilot and reconnect people to what they're doing and why it matters. Over time, this builds a foundation for the larger goal of ACT: openness, awareness, and active engagement in meaningful life directions. While ACT doesn't require formal meditation, structured mindfulness practices can serve an important role, especially for clients who benefit more from ritualized ways of slowing down and tuning in. Formal mindfulness exercises include practices like body scans, breath awareness, and guided visualizations. These can be offered during session or as an in-between session homework. The therapist might guide a client to spend 5 minutes focusing on their breath, noticing when the mind wanders, and gently returning attention without a judgment. The key is not relaxation, though calmness may arise, but training attention. Clients learn how to anchor their focus, how to sit with discomfort, and how to relate differently to their thoughts and feelings. For many, this is a new skill and takes practice. It's important to adapt these practices to the client's needs. For example, a trauma survivor might feel overwhelmed during a body scan. In such cases, start with external anchors, like noticing 5 sounds in the room, or simply return to the rhythm of their breath. Formal mindfulness isn't a one-size-fits-all, and in ACT, it's always in the service of psychological flexibility. We're not aiming for enlightenment, we're helping people show up more fully in their lives with presence and purpose. In ACT, self as context refers to the ability to observe thoughts and feelings without becoming entangled in them. It's the you that notices, the stable perspective from which experiences come and go. Techniques to cultivate self as context help clients step back and relate to themselves with more flexibility and compassion. Many clients conflate their identity with their suffering. So they'll say things like, I am broken, I am anxious, I am a failure. Self as context techniques allow us to shift from this rigid self story to the observing self. A common metaphor is the chessboard, where thoughts and feelings are the pieces in conflict, but you are the board or the context that holds them all. Another way to access this is through experiential exercises. So the therapist might ask, are you the content of your thoughts or the one that notices those thoughts? This subtle shift helps clients see themselves as more than their pain. They can begin to hold their experiences lightly instead of being defined by them. Journaling from the observer's perspective or labeling experience is also effective. So you can say things like, I'm noticing sadness. These techniques emphasize perspective, spaciousness, and continuity of self over time. Developing self as context isn't about dissociation. It's about anchoring in the part of the self that is always here, calm, aware, and undamaged, so clients can be with difficult experiences without being overwhelmed or controlled by them. The sky and weather exercise is a vivid technique to support the self as context process. It draws on imagery that's easy for clients to grasp. So the sky is like the self. It's open, spacious, and unchanging, while thoughts, feelings, and sensations are like the weather that's always shifting. Here's how it might unfold in a session. You invite the client to imagine their inner world as the sky. Some days are clear, others stormy. Thoughts like, I can't handle this, or feelings like anxiety or sadness roll in clouds and thunder. But no matter how intense the weather, the sky is still there, unaffected, able to hold it all. This exercise helps clients experience themselves as something larger than their momentary experiences. They learn to step back from painful content and observe it without judgment. The goal is not to push the weather away, but to let it come and go in its own time, knowing it doesn't define who they are. You can deepen the experience by pairing it with breathing exercises. So asking clients to gently notice what's arising and label it a storm of doubt or a drizzle of worry. Then they can return to the spacious sky of awareness. This metaphor makes abstract concepts tangible. It builds a safe psychological distance from distressing experiences and strengthens the client's ability to stay present, especially when storms come rolling in. Perspective taking is a cornerstone of self as context work in ACT. It allows clients to view their experiences from multiple vantage points, helping them loosen rigid self-concepts and increase empathy for themselves and others. This technique can be especially powerful in sessions where clients feel stuck in blame, shame, guilt, or self-criticism. By helping them shift perspectives across times, roles, or imagined viewpoints, we can interrupt fusion with painful self-narratives. For example, a therapist might say, what would your 10-year-old self say to you right now? Or, imagine you're watching your life as a movie. What do you notice about the main character? These prompts gently open up space for observation and compassion. Another approach is using chair work or imagery. One chair represents the client's current self, another represents an outside observer or a wise future version of themselves. Switching physically or mentally between these perspectives brings insight and flexibility. Perspective taking also enhances interpersonal functioning. Clients can be invited to imagine how a partner or a friend might see a situation, reducing black and white thinking or emotional reactivity. In ACT, the aim isn't to invalidate painful stories, but to help clients hold those stories lightly and move beyond them. Perspective taking expands awareness, making it easier to respond in ways aligned with their values rather than being ruled by old scripts. Acceptance in ACT means actively opening up to painful thoughts, feelings, memories, or urges without trying to change or avoid them. It's not passive resignation. It's a deliberate, courageous stance of making room for discomfort so you can move forward with what matters. Many clients come to therapy with the default goal of symptom elimination. They want to get rid of anxiety, depression, or anger. ACT shifts the focus. Instead of fighting with these experiences, we help clients change their relationship with them. Techniques to support acceptance include body scans, mindful awareness of emotions, and exposure activities. These practices gently invite the client to notice where distress shows up in the body, in sensations, or in images, without judgment or resistance. They learn to say, "This is here, and I can allow it to be." You might guide clients through a script where they imagine painful thoughts as waves in the ocean, or invite them to breathe into a tight area of the body and soften around it. Metaphors such as dropping the rope in a tug of war reinforce the idea that fighting often intensifies suffering. Importantly, we tailor these techniques to the client's readiness. If a person is overwhelmed, acceptance might begin as a micro practice, just 10 seconds of noticing a difficult feeling without trying to fix it. Through these exercises, clients learn that pain doesn't need to be an obstacle. It can be a passenger in the vehicle of life, along for the ride, but not behind the wheel. The tug of war with a monster is a foundational metaphor in ACT that illustrates the futility of control and the power of letting go. In this exercise, clients are invited to imagine themselves in a tug of war with a monster, a representation of their painful thoughts, memories, or urges. They're holding one end of the rope. The monster is from the other side, holding the other. And in between them is a pit, symbolizing despair or loss. Clients may recognize this struggle, constantly pulling, fighting, and exhausting themselves. Yet the monster never tires. The harder they pull, the more stuck they feel. Then the reframe. What if you drop the rope? This moment is powerful in therapy. It's not about giving up. It's about stepping out of the struggle. The monster may still be there, but you're no longer feeding the fight. By dropping the rope, clients learn to accept that painful experiences can be present without dominating behavior. The tug of war exercise teaches a core ACT lesson. Control is the problem, not the solution. And freedom comes not from defeating the monster, but from disengaging with the battle altogether, so you can return to living. The Chinese finger trap is a classic ACT metaphor, brought to life with a simple children's toy. When clients place their fingers in both ends of this woven tube and pull, the trap tightens. The natural reaction is to pull harder, only making it worse. The only way out is to do the opposite, to lean in, to push inward, relax, and then allow space. In therapy, this metaphor shows how struggling with internal experiences, like anxiety, shame, and intrusive thoughts, tighten the grip those experiences have on us. The more we resist, the more entangled we become. You can introduce this exercise by letting clients try the trap themselves. As they instinctively pull harder, they feel the tension increase. Then you can guide them to pause, breathe, and gently move inward. This action mirrors the practice of acceptance. Instead of fighting discomfort, we allow it to be there. And paradoxically, that's what sets us free. The power of this metaphor lies in the felt experience. It's a tactical reminder that fighting pain often intensifies it, and relief comes not from control, but from willingness and letting it go. The Chinese finger trap is especially helpful for clients stuck in control strategies or perfectionism. It bypasses intellectual defenses and lands directly in the body. It's also playful, which makes it easier to engage with deeply emotional topics. Use it early in therapy or when clients hit resistance. It often opens the door to deeper conversations about avoidance and alternative responses to distress. Diffusion is the process of loosening the grip that thoughts can have over us. When we are fused with thoughts, we experience it as a literal truth. The thought that I'm not good enough doesn't just pass through our minds, it feels like a direct statement of fact. In ACT, we teach clients to create space between themselves and their thoughts. Diffusion techniques help clients observe thoughts as mental events, not commands, facts, or threats. One foundational method is to repeat a thought out loud until it loses its emotional charge. For example, saying, "I'm a failure," over and over can reduce its power and transform it into just a sound. Other techniques include singing thoughts to the tune of "Happy Birthday," or saying them in a silly voice, or writing them down on a note card and then carrying them around. The goal isn't to mock or minimize serious pain, but to loosen the sense that this thought is who I am. These exercises promote cognitive flexibility, helping clients see that they have thoughts. They are not their thoughts. And once they can step back from unhelpful mental chatter, they regain the ability to act in line with their values, not fear. In practice, it's essential to normalize diffusion. Let clients know that the goal isn't to eliminate troubling thoughts, but to change the relationship with them. Over time, they'll learn that they can hold their thought more lightly and keep moving forward. One of the simplest and most powerful diffusion tools in ACT is adding the phrase, "I'm having the thought that." This tiny verbal shift reframes the thought from a statement of reality to a mental event. Let's say a client thinks, "I'm a terrible parent." That belief may trigger shame, avoidance, or self-criticism. But by reframing it as, "I'm having the thought that I'm a terrible parent," the client gains distance. It's no longer a truth, it's just a thought. And thoughts are temporary, subjective, and open to examination. You could take this technique further. "I'm noticing I'm having the thought that I'm a terrible parent." Or, "I'm aware that I'm telling myself the story that I'm a terrible parent." Each layer adds space and perspective. This technique works well because it doesn't require debating the thought or proving it right or wrong. It simply invites the client to see the thought for what it is, a passing experience in the mind. In session, you can model this by using your thoughts as examples, or gently inviting the client to try the phrase out loud. It may feel awkward at first, but even that awkwardness is part of the practice. "I'm noticing that this is awkward right now." Over time, this shift becomes second nature. Clients learn to spot when fusion is happening and apply this verbal diffusion to regain clarity and choice. It's a skill that can be used in everyday life, anytime a thought begins to hijack behavior. Physicalizing exercises are techniques that help clients externalize their thoughts, feelings, or urges by giving them form or motion. Instead of trying to process everything verbally, we bring the experience into the body or in the space around the client. This creates new possibilities for awareness and change. For example, a client might describe their anxiety as a Rubik's Cube. And a therapist would ask, "Well, why don't you place that in front of us, maybe 4 feet out, right here on the floor? What shape does it have? What colors do you see? What weight, if it had a weight, would it have? Would it be heavy, light? What other features do you notice?" Having them be able to describe the objects helps them to place this emotion outside of themselves. Instead of being embodied, it helps it to be externalized or physicalized. Physicalizing allows clients to step back and observe internal experiences without judgment. It transforms the abstract into the tangible and the overwhelming into something more manageable. These exercises are especially helpful when words fall short or when clients are stuck in cognitive overanalysis. They bring ACT to life, literally, by engaging the whole person in the therapeutic process, creativity and all. Helping clients clarify values is central to ACT. But value clarification isn't just a one-time conversation. It's an ongoing exploration of what matters most in a person's life. Values give meaning to discomfort and direction to change. ACT values work often begins by identifying life domains or areas such as relationships, health, work, spirituality, and growth. Then we explore what kind of person the client wants to be in those domains, not what goals they want to achieve, but how they want to live. You might ask, what do you want to stand for in your relationship with your partner? Or if this struggle weren't in the way, what kind of life would you be moving toward? We also use experiential exercises like the values compass, values card sort, or reflective writing. These techniques create space for the client to feel their way into values, not just think about them. That emotional connection is key. Values aren't necessarily intellectual, they're heartfelt, they're passions. It's helpful to distinguish values from goals. Goals are outcomes that can be checked off a list. Values are directions we can move in endlessly. You never finish being a loving parent or living with integrity, but those values can guide choices every day. When values become clear, discomfort often makes more sense. Struggles with anxiety, depression, or avoidance aren't just random. They're often barriers in the way of what deeply matters. Framing discomfort in terms of values creates motivation and meaning. One engaging way to explore values is the top 10 moments exercise. This technique invites clients to reflect on the 10 most meaningful, joyful, or powerful moments of their life. Then use those experiences as a window into their values. These moments could be small or large, joyful or bittersweet, such as holding a newborn child, walking alone in nature, graduating, comforting a friend, or even persevering through a painful experience. The point is not perfection, it's depth of meaning. As clients describe these memories, you can explore what made this moment matter? What personal qualities were expressed? What does this say about who you are and what you stand for? Patterns usually emerge. Clients may notice recurring themes like connection, creativity, service, learning, or courage. These are values in motion. This exercise is effective because it roots values in real lived experiences. Instead of asking abstract questions like, what are your values? It invites clients to remember when they felt most alive and draws values from those memories. It also helps shift focus from pain to possibility. Even clients who feel stuck or hopeless can often recall meaningful experiences, and those memories remind them that values-based living is still possible. Encourage clients to write these top 10 moments down or share them out loud. You might even revisit the list over time as therapy progresses. As clients clarify their values, they can begin making choices that align with them, even in the face of difficulty. Traditional CBT or brief solution therapies often use the miracle question. If you woke up tomorrow and all your problems were gone, what would be different? ACT adapts this by shifting focus from problem removal to values-based action. In ACT, we might ask, if the struggle you're facing wasn't dominating your life, what would you be free to do? Or if anxiety, depression, or pain weren't dictating your behavior, what kind of person would you want to be? This version of the miracle question assumes that suffering doesn't need to vanish before life becomes meaningful. It recognizes that we can live fully with pain, not just after it's gone. The alternative miracle question also shifts the client from avoidance goals, I'd stop being anxious, or to approach goals, I'd reconnect with my family, or I'd write my book. It helps uncover the underlying values that suffering has been crowding out. Use this question when clients are feeling stuck, hopeless, or disconnected from what they really care about. Let them imagine not a perfect life without problems, but a life that's rich, full, and worth showing up for. As they answer, guide them to notice the values embedded in their vision. Those values become guideposts, helping shape goals and committed action steps moving forward. This shift from fixing to living is at the heart of ACT. The miracle isn't just the absence of pain, it's the discovery that life can still be deeply meaningful, even with pain in the picture. Committed action is where values come to life. It's the doing part of ACT, taking concrete steps aligned with what matters most, even in the presence of fear, doubt, or discomfort. This is where psychological flexibility becomes real. Committed action isn't about perfect execution. It's about persistence with flexibility. ACT encourages clients to make values-based moves that are practical, meaningful, and sustainable. That often means starting small. For someone whose value is connection, it might be as simple as sending a text to a friend or attending a family event despite anxiety. We use SMART goals, specific, measurable, achievable, relevant, and time-bound, to make action steps manageable. But we also normalize setbacks. In ACT, failing at a goal isn't failure, it's feedback. It helps the client notice what got in the way and try again, perhaps with more compassion or a modified approach. Therapists can support clients by reinforcing the link between action and values. What would it mean to take this step? Or how does this move connect with the kind of person you want to be? Committed action is not rigid behavior change. It's flexible, values-guided movement forward. Sometimes it's bold, other times it's quiet and incremental. But over time, these steps create a life that feels authentic, vital, and self-directed. When clients build momentum with committed action, they begin to experience transformation, not by erasing pain, but by choosing purpose over that avoidance. It's how they reclaim their lives, one meaningful action at a time. The values, goals, and actions exercise is a structured way to help clients map their intentions into reality. It's one of ACT's most practical tools, creating a bridge between the abstract clarity of values and the tangible steps of committed action. Start by identifying a value. For example, being a supportive partner, pursuing creativity, or engaging in lifelong learning. Then help the client set a goal connected to that value. The goal should be clear, achievable, and something they can track and build on. From there, generate specific actions, smart, immediate steps they can take to begin living that value out. Here's how the exercise might look. So the value, being a present and loving parent. The goal, spend more quality time with my child this week. The action, plan 1 hour of screen-free time together this Saturday. This format encourages forward movement. It shifts the client from insight to implementation. And when they encounter resistance, you can explore whether the action is too big, too vague, or disconnected from a deeper value. This exercise is especially helpful for clients who get stuck in overthinking, perfectionism, or emotional avoidance. It gives them something concrete to do, something that matters, and reinforces their agency. Encourage clients to repeat the process across various life domains. Over time, this values, goal, actions alignment becomes a natural rhythm. It's not about fixing the past or predicting the future. It's about choosing what matters now and moving toward it one action at a time. Exposure has long been a staple of behavioral therapies, but ACT approaches exposure differently. Instead of aiming solely to reduce fear or distress, ACT frames exposure as a willingness practice, a way of opening up to discomfort in service of living fully. Traditional exposure often emphasizes habituation, the idea that anxiety will decline through repeated exposure. But ACT aligns more closely with inhibitory learning theory, which suggests that what really matters is learning that feared outcomes can be tolerated or are less likely than believed. In ACT, we might ask, are you willing to feel anxious if it means reconnecting with your friends? This question reframes exposure as a values-based choice, not a tool for symptom elimination. Clients are guided to approach feared situations with open awareness, diffusion from scary thoughts, and acceptance of bodily sensations. The exposure becomes a real-time opportunity to practice psychological flexibility. You can support this by helping clients reflect on what they learned from the experience. What did you notice? Did you survive the discomfort? Was it worth it given what you care about? Inhibitory learning strengthens what clients experience when clients experience Inhibitory learning strengthens when clients experience mismatch, when the fear doesn't happen, or when they learn they can handle it. This creates a new learning pathways that undermine avoidance patterns. Ultimately, ACT's approach to exposure isn't about getting rid of anxiety. It's about reclaiming life and discovering that the things we fear often lose their power when we stop running and start showing up. Thanks for watching this video. If you found it helpful, go ahead and like, subscribe, and share it. And make sure to click the notification bell to stay updated on new releases. Your support helps spread the message of learning ACT together and being more mindful. In our next video, we'll move into the topic of structuring interventions. So how to shape sessions, respond to stuck points, and guide the ACT processes with flexibility and clarity. It's one thing to know the techniques, it's another to know how to apply them effectively across time. And that's where we're going to be headed next. Thanks again for watching, and I look forward to seeing you in the next one. Remember, your journey towards a more purposeful and mindful life begins with a single click.